If you have or suspect you may have a health problem, or if you require answers to specific healthcare questions or concerns, you should consult your physician or healthcare provider and not depend solely on information presented in this program.
Hello, I'm Dr. Steve Garner, and welcome to Ask the Doctor. It's great to be with you today. As you know, this is our 14th season, and this program was created to assist you in understanding medical issues so you can take charge of your own health. It's more important than ever to be an informed patient, and we're here to bring you timely health discussions. Now, for those who are new to the show, there are two ways to get your questions in. First, you can call the live phone line at 718-499-6101. And second, you can email us your questions to askthedoctor@netny.net, and we're going to bring them into our discussion. Now, for this episode, we have Dr. Anthony Saylor, pulmonary attending at New York Methodist Hospital, Dr. Daniel Stevens, a laparoscopic surgeon and a general surgeon at Metropolitan Hospital, and Dr. Alexander Shaknovich, cardiology attending at New York Methodist Hospital. And welcome to all of you. We have a special treat here today because up until last week, this was going to be the season finale. So I invited our three top guests, and we got them here. This is a money-back guarantee. If you don't like the show, you're getting your money back. Wait till you see when we introduce them. I get chills thinking about it here. But got a great show ahead, and we're going to go first to the news, and then we're going to go to our quiz, and then meet our guests. So in the news, the summer's coming up. The sun is out. We're going to be out this Memorial Day weekend. And we're going to be putting on suntan lotion, I hope, to avoid melanoma and other cancers. And oftentimes, the most expensive suntan lotion is not the best protection, and it has many drawbacks. So Consumer Report did a study and found that the Target store brand called Up and Up's Sports Continuous SPF 30 is the cheapest, costing 88 cents an ounce, and actually the best. There were three runner-ups. They were rated for the UVA and B waves. Now remember, the A waves do aging and cancer, as does the UVB waves. You want something that protects against both. So if you're keeping score, you want to write this at home. This number 2 came in was Banana Boat Sport Performance. I mean, these names are very hard to remember. I don't know who's coming up with these. The next one is Coppertone Sport Ultra Sweat Proof. But by the time you say it, you get a sunburn. And the next one is CVS Fast Cover Sport SPF 30. Now, there was two chemicals. You want to look at the ingredients, and if you see something that says retinol palmitate, you don't want that one because that's been linked to birth defects and cancer. And the other one you want to look for is oxybenzone because that interferes with sexual development. So you want to stay away from any brand that might have oxybenzone. And the FDA is actually looking at taking these out of the products now, but there have been a number of studies that have shown problems. Now, if you want the worst smelling one, somebody wants to play a trick on their friends, get All-Terrain Aqua Sport Performance. It's described as slightly stale oil scent mixed with plastic. So I don't know. And also, if you happen to like a pale pink tinted white residue that feels waxy, draggy, and slightly tacky, then get Burt's Bees. Okay, so Burt's Bees if you want that. So we get into it. Basically, though, use suntan lotion. Even if it smells, it doesn't look good, it really can help you. And also bring an umbrella, and try and avoid the sun during the peak time periods. Now, also in the news was a miracle, actually. A paralyzed man, a 25-year-old man, who was able to stand with assistance from an electrode or an electrical device put into his spine. And his spine had been cut off in half from the head down to the toes. It was cut in the middle part so that the messages couldn't get up to the brain from the muscles and back down. And we never knew that the spinal cord could basically take over as a brain. And when they put in the electrodes into the spinal cord and caused electrodes stimulation, that actually the spinal cord began to act as the brain and could pick up signals from the patient's feet and actually help him to stand. He also improved his quality of life. Bowel and bladder control came back and sexual function. And this is just the beginning. With a lot more training, they're hoping to get him to walk. Now, it's not for everyone. If you've been paraplegic for more than 5 years, it's not going to work. And if you have a total severing of it, that there's no sensation, that also is going to be tough. But it's something that is on the horizon, and it offers great hope. Another story is interesting. For those who are pregnant out there and want to deliver their babies earlier, it showed that delivering the baby at 37 weeks or under actually gave the baby a double chance of dying as those that went to term or to 40 weeks. So not to pester your doctor to do it, and actually this study came out and said it was really unfortunate and not the right thing to do to try and have elective deliveries for no reason early, just for convenience. So continue the pregnancy to at least 39 weeks is crucial to baby's health. Of course, if there's a reason to deliver sooner, you follow your obstetrician. But it's something to keep in mind and to ask about. We have a number of people. I want to say hello to John Basili out there, a loyal listener, Tony Izzo and Sharon Davis, who had dinner at the Tuscany Grill. Have you ever been there? It's a nice place. Yes. Small little restaurant, nice atmosphere, delicious place, very friendly. When Senior Bennett's out there, I have to say hello. He's only missed one show now in 14 seasons. And we have a birthday girl out there, Rebecca, 4 years old. Happy birthday to you, Rebecca. And watches the show occasionally, gets a mother to, allows her to stay up and watch it. So have a great birthday and continue to listen. Thank you. So now the quiz, okay? Get the pencils and papers ready. Which is the most common species of mammals on the face of the earth? Which is the most common species of mammals on the face of the earth? I think the quizmaster, Dr. Laparoscopic, has given us a good one this week. So we're going to take a short break, and when we come back, we're going to go to your questions, where the topics are lung disease, surgery, and cardiology. Now, the number to call is 718-499-6101, and you can also email your questions to askthedoctor@netny.net. We'll be right back.
Place your business on TV by becoming a sponsor to one of NET's family-friendly programs. See an increase in your revenue by reaching a potential audience of 4.3 million viewers in the tri-state area. We have a number of packages available, and we'll even produce your commercial. For information, contact us at the number on your screen and get ready to see yourself on NET.
And welcome back to Ask the Doctor, where our topics are lung disease, surgery, and cardiology. Now let's meet the doctors. And I told you we had an all-star cast. You tell me what you think. First, Dr. Anthony Saylor, pulmonologist par excellence, member of the Board of Trustees of the hospital, and most of all, a great Yankee fan.
Very big Yankee fan. Thank you, Steve. Nice to be here. And just would like to let the audience know a little what you do as the chair of radiology in the hospital. That really is sort of the most important department, because length of stay and so many issues depend upon getting accurate reads. And I can tell you, I've been at Methodist 25 years, and your division is doing a wonderful job.
Thank you very much.
It's great to work with you.
Thanks,
and you're a Yankee fan.
A big Yankee fan.
Great.
So what do you think? What's going on with the Yankees? The starting pitch is a little better than we thought.
The hitting's a little concern.
Yeah. What do you think about the old man, Jeter?
I think he'll be okay.
You think so?
I think he'll be okay.
Okay, get a little nervous. And
Yes.
any great trips planned or anything coming up?
In American College of Chest Physicians, Dr. Ray Youth, the chief of pulmonary at Methodist, will be crowned as the president of the ACCP
That's
in
quite
late
an honor.
October, so that'll be very nice.
That's for a community hospital.
Yes,
Isn't that unusual?
Yes.
Excellent. He's been a guest on the show many years, but we can't. He's traveling now all over
He's
the
traveling,
world.
too busy being a president.
Yeah. So anyway, we're going to be getting back to you. Questions
Thank
on
you.
pulmonary disease, World Trade Center, a lot of questions coming up, asthma, chronic obstructive pulmonary disease. So
Thank you.
I hope you're prepared. Your strength is there. And of course, Dr. Daniel Stevens, one of our favorite guests as well.
Thanks.
And this laparoscopic surgery, it throws people off. What does that mean exactly?
Well, all it means really is, instead of making a large incision in the abdomen to take out a gallbladder, take out a colon, take out an appendix, repair a hernia, you make smaller incisions and you put in what are called trocars, which are little devices you put instruments through, and you insufflate the abdomen, you blow it up with air, and you're able to operate that way. So really you're saving a larger incision, and there are certain benefits
But
to
you
it.
still do the same surgery. Like
You still do the same surgery.
If you need the gallbladder out, it's coming out by this technique. Very good.
I feel very left out. I'm a Mets fan.
I know. Now, you have any thoughts? I mean, it looked like they were coming around.
Nah, I don't want
But and how about trips? We always like to hear about your exciting trips. Anything coming up?
We're going to the Caribbean. That's our next big trip, to Barbados.
Excellent, beautiful.
Never been there, so I'm looking forward to it.
Any particular resort? Or just
I think it's called the Sandy Lane.
Sandy Lane, beautiful resort, excellent place, and we should get there just in time for the rainy season, right? No, that's good. No, but Thanks for being here.
Congratulations on 14 seasons.
14 seasons. I don't know where it went. But anyway, Dr. Shagnovich, if anybody knows, philosopher, always comes up with these thoughts, gives you a different perspective on medicine.
And an interventional cardiologist.
And also an interventional cardiologist. But what's going on with you? What's new and exciting?
Not very much. Very busy practice, wonderful associates, lots of new and old patients, kids growing up.
Yeah, can't stop it.
I made the mistake of sending them to a French school, so I tend to have to go to France to retrieve them every summer. So.
It's not
What a shame.
Yeah, but that's great. I understand you like squash. You did like squash? You do?
I used to play squash all through my medical training, and hopefully we'll pick it up again before my joints give out altogether.
So that's the all-star lineup that we have, and we're going to be taking a question. I see we have a couple lines open, so now is a good time to call in to ask the doctor. But let's see. We always wonder who's going to be the first caller. Could it be Joel? Could it be Maddie? Could it be Grace? Hello, who is this?
This is Maddie.
Maddie, how are you?
I'm hanging in there, Doc.
We heard you had a big fall the other night.
I know.
Maddie fell at home. She has one of these buzzers, right?
Alerts.
But didn't want to disturb anyone. And didn't press the buzzer. Maddie, so you refused to go to the hospital?
Yeah.
But anyway, you doing all right?
I'm still, I have low blood pressure and...
Oh yeah, I know you. Maddie brought this up last week. She has low blood pressure. She's not on any medications. She wants to know, may have caused her to fall. What can she do? She's 9. How old are you, Maddie? 80?
Huh?
How old are you now?
How old am I? 90.
90 years old.
Dr. G...
Very common problem.
90.
Oh. So Maddie, listen to this answer. I'm gonna put you on hold so you can watch the TV.
Okay.
Okay, thanks for calling.
Very, very common problem, particularly with older patients. And it's very important for all of us to realize that transient low blood pressure is more dangerous than even slightly elevated.
About transient. What is it? Because our audience...
Even if your blood pressure is low for a short period of time, seconds, it's more dangerous potentially for you because of this tendency to fall than a slightly elevated blood pressure. So you have to be very careful with medications. Patients who truly have low blood pressure, we actually encourage to have much more salt in their diet, to drink more, especially during summer months, to wear elastic support stockings. There are certain medications that can be prescribed to help you maintain your blood pressure. We caution patients to go from a recumbent position to get up from their bed carefully, slowly. There are all sorts of tricks that are very, very important.
So Maddie, I hope that helps. You got to be careful because we want to keep you around, okay? So have a great summer if we don't hear from you. We're now going to go to Grace on line 2.
Hi.
How are you doing today?
Yeah, well, I fell myself.
Now you fell too?
Yeah, I fell out of taking a shower.
Oh, how are you feeling?
Out of the shower, onto the floor.
This is a big problem. Falls
Yeah,
in.
well, I'm bruised up. I got checked by the doctor.
Well, you're all well?
Well, no, I'm still bruised up. But anyway, what I'm calling about tonight is my blood pressure was 160/90 over a month ago, and he put me on Zestrol.
Okay.
2 weeks, that didn't agree with me. Then he changed me to Topol XL, and I gave me terrific migraines and nausea to my stomach. And he said, stop that pill. After 2 weeks, I couldn't take it either. I went in today, and my blood pressure was normal.
Okay, so what's the question?
Yeah. No, I was just wondering, is that you don't have to put on medication unless your blood pressure goes high again, right?
Dr. Saylor.
Maybe Dr.
You want to take that, Dr. Shagnovich?
I'm a hypertensive. I'm a nervous patient. I forgot to tell you. I'm anxiety and depression. I'm on medication for that. See, those have beta blockers in them, and they disagree with the medication that I take.
Okay, Grace, so let me ask Dr. Shagnovich to take that one.
Again, I'm very sorry you have all these problems. Very important to be very relaxed when you check your blood pressure. We ask our patients to check their blood pressure 5 times a day, actually, for a few days, just to get them to understand that blood pressure fluctuates and to help them realize that they never have to overreact to an isolated reading. When they have an opportunity to check their blood pressure frequently, they help us understand what medications, if any, we need to prescribe for them.
You know, I always see a lot of the older patients, they're on 10 medications, 11 medications, often duplicated, and you wonder if that could be simplified. Do you notice that?
I think it's a real dilemma because many of these patients get put on multiple medications, and a lot of them get on multiple medications from multiple different physicians. So I think it's good to have one primary care physician who's sort of running the show and aware of all the medications.
Grace, you have a question? You have an answer to our quiz?
Well, I wanted to define something. You said mammal. Does that refer that it's an animal in the sea, or is it on the earth?
That is a mammal that's warm-blooded. It usually has a backbone, and it feeds its young milk, and often has hair on the body. It can be in the sea in the form of a whale. Does that help you?
I don't know. I was just gonna.
Take a shot. Take a shot.
A cat.
A cat. Grace says is it a cat? Ah, Grace, you're very close to a cat. Very close. I don't want you to feel bad. Are you still standing? No. Okay, good. I got nervous there, Grace.
Yes, I'm sitting watching you all, and you're all very nice gentlemen, and I appreciate your help.
Thanks, Grace. Be well.
I wanted to check my blood pressure, but
Grace, be well. I think we got disconnected, okay? But be well. We're going to go now to 2 email questions. Actually, one is from Kentucky, one is from Ohio. The show is expanding here. Look at this. First one is from Robert in Kentucky. Dear Dr. Garner, I'm a 52-year-old male who became paraplegic after a fall at work October 22nd, 2003. This is about 8 years ago. My injury is a T10 incomplete. I just saw a news report of a paraplegic male who's now walking. I also saw the treatment he's taking works for neurologic pain, which I have in the extreme. Do you think this treatment may work for me? Thank you so much, Robert. Okay, I have one more on the same topic, and then we'll combine them. It's from Becky in Ohio. Saw Dr. Garner on Fox News talking about the paralysis patient who had a procedure to help walk again. I have a friend who was in a car accident 8 years ago and is paralyzed from the neck down. She laid for 3 years before getting some movement. She has total feeling on the left side and some on the right. How does she get into this program to get this procedure or any help at all? Well, first of all, it's for people who have incomplete disease, where they still have some sensation. So she would fit this category. It's prescribed right now for pain relief, severe pain in the back, and it's often used now. So the FDA has approved this stimulating machine. So doctors do have the machine. If you want to call me after the show, I'll give you some help as to how to get into a program or where they're doing it, where this report came from. But basically, nobody walked yet. What they're doing now is they're able to stand, they're able to wiggle their toes, their ankles, but this is a big change, particularly since a lot of these paraplegic patients develop other diseases like hypertension, obesity, the quality of life issues that we talked about before, bowel control, bladder control. So while it's not there yet, it gives hope. It gives people ability to stand, to wiggle their toes. It's a great moral victory at this time. So if either of the 2 emailers want to contact me after the show, and I'll be able to tell you where studies are being done and how you can get into it, I'd be happy to do that. Okay, thank you. So now we go to, I see Larry's waiting patiently on line 3. Hi, Larry.
Hi, Dr. Garner. How are you?
Is this Larry from Rockland County?
Yes, yes.
Look at this. Now you got eclipsed by Kentucky and Ohio. But how have you been?
Okay. How are you, Dr. Garner?
So what's on your mind?
I wanted to ask Dr. Shakhnovich. I'm considering having a pacemaker installed, and I was told that because I'm having a subclavicle injection of some kind, they told me they can puncture my lung. What's that all about?
All procedures have some risks. Generally speaking, pacemakers are very safe. Cardiologists or surgeons who place them, and you have to choose one well, generally are experienced. They can localize veins into which they need to place their needles now using X-ray equipment so as to minimize the likelihood of puncturing the lung.
But if this is installed in my clavicle area. What's that got to do with my lung? That's
Well, the lung...
Dr. Saylor.
Larry, the lung sort of comes up, the subclavian vessel, the lung, the very tip or the apex of the lung is right near that area. But again, as Dr. Shaknovic said, there's radiology help, there's sonogram guidance. So the chance of your lung being punctured, Larry, is infinitesimal. And if indeed by some chance it was punctured, it could be dealt with very quickly. So please don't utilize that as a reason not to do the procedure.
Okay, so...
What is the reason for the pacemaker?
I was told that I have something, an SSS.
Sixth sinus syndrome.
Yes, yes, that's it. And there are pauses between my heartbeat. Sometimes my pulse goes down to like 40, and it makes me ill, and it gives me very strange feelings. And I don't want to drive a car because one time it made me a little faint, feeling faint. So that was the reason for it. And they said it has nothing to do with any accelerated beats. It's just designed to take care of that that condition. May I ask the cardiologist, of course, is there a better, are the instruments all the same that they put in? I mean, does it make a difference about a brand of any kind?
No, I certainly the implanting physician should discuss the particular brand or the particular type he may be using. Technology keeps improving. Certainly anything that is available to you and me would be more than adequate. And from your description, it certainly sounds imperative, very important for you to have this placed so that you can resume a normal life.
Okay, I really appreciate that. I thank everybody there. And
good luck, Larry.
And thank you, and I look forward to seeing you guys again, hopefully.
Give us a call back to give us a follow-up, please.
Okay, I'll let you know what's happening.
Thanks a lot. We're going to go to our surgeon. I'm going to ask some questions about some of the more interesting things. You know, we've been able to use this new type of surgery to help people where it was unthinkable maybe 10 years ago. Anything stand out in your mind?
Well, it's amazing. I mean, what you were talking about before with the spinal cord transections, even 3, 4, 5 years ago, this was unheard of. This is a procedure. It's not necessarily a surgery, but it's really new technology, and we're applying it in different ways. So I think it's limitless. I think that technology is only going to get better.
Like cancer of the colon, you can use this technique?
Which technique? This
laparoscopic.
Of course. I think it's really helped. I think, you know, initially when laparoscopic surgery started for cancer was a real debate. In the early 90s, even well into the early 2000s, there was a debate whether it's appropriate for cancer. I think it's now pretty widely accepted among surgeons, among medical physicians, that you get just as good a cancer operation with a laparoscopic procedure as you do with an open one.
Now, is there this robot that we hear about? Is that useful in this?
It's very useful for certain procedures. The long and short of it, it's probably mostly useful for the prostatectomy, for the urologist, because they're doing such a tiny connection between the ureter and the bladder that it really helps with that. It's not much of an advantage in general surgery yet. It may be.
Okay, thank you. Let's go now. I see Richard. Hi, Richard.
Yes, hello.
Richard, where are you calling us from?
I'm calling from New York, Manhattan.
Oh, which neighborhood? Because we're always looking for good restaurants up there.
Which neighborhood? Chelsea.
Chelsea. That's on the like in the 30s on the west side.
No, I'm on 16th Street and 7th Avenue.
Have you walked on that west side? Have you seen that west side highway? Skyline is called?
Highline.
Highline.
That's further west towards the Hudson River.
That's nice, right?
Yeah,
nice
yeah, oh yeah. I haven't been up there. I was there when it was not a park. It was still a railroad being rusted to death. Weeds, but not lately.
But I hear an accent. I don't hear a New York accent. Are you from out of town?
No, I'm from Indiana originally,
I picked it up, yeah.
The Korean War, and then New York for the last 50 years.
So, Richard, let's say you have one last meal. We said this is your last meal, Richard. Where are you going to go and eat it?
I've been eating here at my residence, my apartment. I don't go out too much because I had my large colon was removed.
Oh.
It was supposed to have been diseased, and they had operation after I was in the hospital emergency for about 3 days, and they finally decided to operate. And after it was supposed to have been healing, and all of a sudden there was a disease virus came in and made things worse, so they had to operate and remove the large colon, except for the last 6 or 7, 8 inches that goes to my anus and my Pinkston muscle.
Was this done the technique that Dr. Stevens was telling us about, the laparoscopic?
Yes, yes. So what they had was they could either have a colostomy bag connected to the small intestine, or to connect the pieces together, and that's what I chose. And consequently, I have frequent bowel movements, like every 2.5 hours.
All right, let's get to some comment. So do you have a question? Because we're going to address the issue, but any specific question?
I have a question in that I want to know. I still go to my primary care doctor because I'm a heart patient too, and he keeps telling my heart and my lungs are like 18, 20-year-old. Don't worry. But I'm concerned. I do not really know what to eat. What can I do to eat? Do I have frequent bowel movements? Because there's the large colon took up a lot of excess water, right?
Right. All right, Richard. So
let's
go to...
water is being caused me to, that doesn't have to go through a large colon because it's not there. It has me frequent bowel movements, you know.
I think, well, let's ask Dr. Stevens, because what you're experiencing may not be, you know, that unnatural.
Richard, just one question. When was your surgery?
I got out of the hospital after 1 year. There was an operation at St. Vincent's, which they went belly up and closed. I went into rehab for the 2 pieces to what they call rest. And finally, the surgeon decided after 3-4 months to connect them. And then I got out last July.
Okay, so it's been less than a year since the connection. So, number one, I understand that it's not pleasant having multiple bowel movements a day.
Yeah, frequent bowel movements.
But you know, over time, your small intestine, the pouch that they created, if they did, or the connection, it actually adjusts to your body. So it's possible that just by doing nothing and eating your whatever diet you're eating now, your bowel movements will become less frequent and possibly more solid over time.
Oh my God, no one told me. I got no information.
Yeah, so that is definitely a possibility.
There's a certain amount of guilt why I had to have 2 operations, and no one wants to talk about it, that they found me on the floor.
So, you know, that's good news. And second of all, there are dietary modifications you can do. You know, the number one thing I could recommend is fiber.
Stick with the fiber, right? Peanut butter sandwiches on whole wheat bread.
Fiber is found in all sorts of foods. And number 2, you should take fiber supplements, however you want to take it. Metamucil, FiberCon, fiber crackers. There are a million different over-the-counter products.
Is that the kind of stuff that makes it? It's a powder. You take it in the water, and it makes it.
Exactly, Metamucil. But there's all different sorts out there. So there's some dietary things you can do. Number 1 is fiber. And then after time, after years, if it doesn't get better, the last thing you want to do is another operation. But that's a possibility. But that's really, you should try all these other things first and give it time. I hope it does get better for you.
Richard, how did you find the show?
Small intestine lengthen itself?
No, it hypertrophies. It grows bigger. And it sort of actually can change into a more like a large colon, actually.
Oh, see, I knew there had to be a God someplace that wasn't going to put a final. But I asked questions. They all had such guilt about that disease that when they did not watch me after an operation, they put me in a chair, and evidently I fell on the floor.
Richard,
I don't know why.
Richard, you're going to move on. But I want to thank you for the... How'd you find the show? Just by chance?
I have TV, a computer, and air conditioning, and that's my pleasures. Because I can't get out to have dinner in most restaurants, because, you know, most restaurants you sit longer than 2 hours.
Yeah. But
and I don't care to use their toilets.
Feel better, Richard. We appreciate the call, and call us back. Let us know how you're doing.
I've been watching it for some time, but I got the nerve now to talk about it.
The first time, long time, we called.
So that's why I called.
Take care, Richard.
Good luck.
Bye. Before we continue with the questions, I have to mention that the Net is just like any other nonprofit organization out there, and that we're feeling the pinch of the tough economic times. It's not a pledge drive, but it's actually a call to action. If you enjoy this program, Ask the Doctor, and any of the other programs you see on the Net, it would be very helpful if you could show whatever support you could. Now, whatever you contribute is fine, a little bit, a lot, whatever you can do. It just shows your support, and it's very important to the show's continuing. Also, if there's any business out there that would like to partner, like you could be the official car of the Ask the Doctor or the official pizza store of the Ask. They had Franny's the other day. Maybe they want to come on. So there's a person who's doing all this. His name is Anthony Pissarro. He's at 718-499-9705. If you call him, it would be a big help to the station to allow us to continue. And thanks. And let's get back to the questions now. So go to Thelma. Hi, Thelma.
Hello.
Where are you calling us from, Thelma?
I'm calling from Bed-Stuy.
Bed-Stuy. We never found a place out there, huh? we drive around out there, and you keep driving. There's no restaurant in Bed-Stuy.
No, there isn't. No. It says restaurant, but not too many.
No. So what can we do? You have a question for Dr. Saylor tonight?
Yes.
Yes.
It's concerning my granddaughter. She has a dry, hacky cough. And sometimes she get the cough, I have to admit her in the hospital. And the cough keep coming back forth. She one week she's good, next week she's not.
Dry hacking cough.
Thelma, how old is your granddaughter?
She's 14.
Okay, so Thelma, there are certainly a lot of reasons for cough. The commonest ones, particularly in a 14-year-old, would be nasal drip. A lot of young people have a lot of nasal drip or allergies, particularly during this time of the year. So that's something I would consider. Or she may be an asthmatic. Sometimes asthma can sort of masquerade without wheezing, without any shortness of breath, and they cough a lot. So certainly run those by her doctor. And if indeed her doctor wants a test for those, I think that's a good first start.
Yes, but she gets tightness in her chest, and she be bending over because of the pain in her chest. She was admitted in the hospital last year. She stayed for 1 week, and they run all tests on her. I'd asked them could they do an MRI on her to see if it's the heart, because when she has the pain, she constantly, her toes begin to curve up, and she have pains in her leg. You can see her toes just curving up.
Yeah, it'd be a little unusual, although not impossible, for a 14-year-old to have a heart issue. Rather than an MRI, maybe an echocardiogram would be a nice, simple test to check her heart. But it sounds like asthma is certainly something I would think very seriously of. So what I would do, Thelma, is speak to her primary care doctor, and if the cough and chest tightness persist, there's a lot of maintenance medications we could use for asthma. So don't feel hopeless. There's a lot of good medicines out there that could help her.
Okay.
Thanks.
Good luck.
And good luck. Thank you so much.
Thanks a lot, Thelma. Have a good night. Okay, we're going to take a short break. When we come back, we're going to have a question for Dr. Shagnovich on the email. Now, the topics are lung disease, surgery, and cardiology. We'll be right back.
Place your business on TV by becoming a sponsor to one of NET's family-friendly programs. See an increase in your revenue by reaching a potential audience of 4.3 million viewers in the tri-state area. We have a number of packages available, and we'll even produce your commercial. For information, contact us at the number on your screen and get ready to see yourself on NET.
And welcome back to Ask the Doctor, where our topics are lung disease, surgery, cardiology, where we have Dr. Anthony Saylor, Dr. Daniel Stevens, and Dr. Alexander Shagnovich. Now let's go to the questions. I understand we have Grace on line 3, who I don't know if it's the same Grace. I'd be curious. Hello? Grace?
Yes, it is.
Grace, you already used your guest for tonight.
I'm thinking of that. No, but for the quiz, I want you to repeat the quiz.
No, but Grace, we already did it once tonight. No, didn't you guess cat?
Yeah, but nobody even gave a hint. Well, I wanted to say a squirrel.
Squirrel. Okay, I don't do this all the time, but I like the. Can I hear that again? What is the answer?
Squirrel.
Grace says squirrel. Second guess, squirrel. Oh, Grace.
Okay.
Are you okay?
Yeah.
You feel bad. Grace has been.
You're not asking the people. I think other other people were going to get some guests, but nobody guessed anything.
I know.
I bet it's a mouse. That's the only other thing I could think of.
So, Grace, we'll talk to you later.
Okay, thank you for answering my call.
Thanks, Grace. Take care. We're now going to look from Linda in Brooklyn, who has a question for Dr. Shaknovich. She said, Dr. Shaknovich, I'm 59 years of age. I've been diagnosed with a left bundle branch block, and I have a heart murmur. How serious is this, and what treatment is recommended? My cardiologist says I may need a pacemaker at some point.
Well, I'm very encouraged that you have gone to see a cardiologist. The left bundle branch block by itself may not mean very much, but I think it's very important to see if there are any other conditions that may have caused it or be associated with it. And certainly it's going to be very important for you to continue to see your primary care physician, but also your cardiologist on a regular basis. Lots of people live with left bundle branch block without requiring pacemakers. Some come to need them. Again, it's highly individual. The important thing is to pay attention to your symptoms and to work with someone long-term so that you can make good quality decisions.
And the murmur?
Well, the murmur, an echocardiogram, I think, would be very helpful. In general, cardiology today is very, I don't want to use the word straightforward. It is straightforward. If you find a reasonable physician who does things in a logical fashion and communicates his findings to you, typically you make good decisions all along the way.
Thanks a lot. The question now is, by the way, I want to get to the quiz because people may not have remembered. What species of mammals are the most frequent? You know, in other words, what has the most number of creatures? How would we say this? You like that? Creatures. The most number of creatures of mammals. Which is the most? Grace gave two guesses, cat and squirrel. Okay, so, and we're playing for that coveted trophy. So, what is it? Go to Faye on line 2. Hi, Faye.
Hi.
Faye, how are you?
I'm good. Oh, let me mute my TV.
Okay.
Okay, hello?
You have a very nice voice, very soothing voice.
Oh, well, I'm calling about because in August of 2010, I was in distress because of I had COPD.
Okay.
And I was in distress, and then I went to the hospital. I was in there for like a while, and they gave me, I had a tracheotomy. Okay, and then they took out the trach in March of 2011. But I'm on oxygen therapy and stuff, and I'm still like on oxygen like every day. But sometimes I feel like winded, like breathless.
Yeah, let's go to Dr. Saylor on this one. You had to share troubles, it seems like here.
Yeah.
Hi, Faye. Well, I'm glad you're feeling better. If the tracheostomy was removed, that means you must be doing better. Let me ask the most important question. Are you a former or current smoker, Faye?
I was a former smoker. I don't smoke. When I went into distress, that's the day I stopped smoking.
Good. Well,
August 28th of 2010.
Well, Faye, thank God that's probably the best decision that you made.
Yeah.
And fortunately, stopping smoking is an important part of your treatment. Now, COPD, Faye, is a very common disease, and the fact that you are breathless is not uncommon. A lot of patients with COPD complain of breathlessness. I think you should know that don't get discouraged by your breathlessness. There's medications, inhalers that can help.
Yeah, I'm on medication. I take, I got Pulmicort, Risposes.
Good.
I take albuterol. And I take Spiriva.
Spiriva, good. So all of those are very appropriate. It sounds like your physicians are doing really a phenomenal job.
Yeah, and I go, to my appointments like I'm supposed to. But I live on the top floor, so I really don't walk down those stairs. Because if I do, I can walk down the stairs. Like coming back up, I get breathless. Sometimes when I'm at the doctor's office, if I move around too much, I get like that. I can catch my breath, but I feel not like I used to.
Right. Faye, don't get discouraged. It sounds like you're doing well. You're on the appropriate treatment. The last point I would have for you is when you get ill, contact your doctor immediately.
No, I do. I've been to the hospital. I've been hospitalized so many times after the surgery. Like if I get a cold, I have to go to the hospital.
Right.
No, I can't be home. I have to go.
Right. Don't get discouraged, Faye. It sounds like you're heading in the right direction. The tracheostomy is out, and you keep your faith, okay?
Okay.
Thank you, Faye. I got to ask Dr. Stevens a question. I know it's Dr. Shaknovich a similar question. How do you know when a stomachache is severe enough to go to the hospital, and it's just opposed to being a stomachache?
Well, I think if it's, number one, something different than you usually experience, obviously, and that would trigger you to go to the hospital. If it lasts longer than it usually does, I mean, you know, for an individual patient, you know your body the best. And if something's unusual, if it's lasting longer, it's not going away, it's getting worse instead of getting better, which it usually does, or just something doesn't feel right, you don't feel right. You know, it's not a bad idea to go see a doctor, go to the emergency room if you feel it's really severe enough.
How long is it, like, if you haven't had a bowel movement in 3 days, is that, like, what's...
You know, that's a common question too. Everyone's different. So for some people, maybe normal once a day. It's not necessarily the case for everyone. Some people have every 2 days, every 3 days. That may be normal for you. So as long as you're thriving and comfortable and it's not causing any problem, that may not be a bad thing.
Very nice. And Dr. Schneider, I'm asking a similar question with indigestion, chest pain. How do you know when it's significant?
Often not very easy to decide. Depends a little bit on who you are. The older you are, the more attention you should pay to pain in your chest. If you're a smoker, diabetic, have high blood pressure, high cholesterol, family history, and if it is a new symptom for you and you're not sure, then the better part of valor would be to call your physician, and if it happens at night, to go to the emergency room and accept all the stresses of being there for a couple of hours to be certain. And once you've been cleared, very important to go and see a doctor, bring these symptoms to his or her attention so that appropriate tests can be done to understand whether or not they are.
That's good advice, actually, to people out there, because sometimes they're stoic. They say, I'm not going in. I can tough it out. Don't tough it out. Let's go to Maria. Hi, Maria.
Hello.
Hi, Maria. Where are you calling us from?
Brooklyn, Midwood area.
Which one area?
Midwood.
Oh, Midwood. Very nice out there. Where do you like to go out there? We haven't had any good restaurants tonight.
Try some Russian restaurants.
Maria?
Yeah?
Which one do you like? What's your favorite?
Rasputin. Rasputin.
Rasputin. Nice place.
Rasputin. R-A-S-P-U.
I went into that place and they're drinking vodka right? Is that what you get?
I wouldn't know anything.
I was numb. I was ready for dental surgery because you keep drinking vodka, a glass of water, vodka. Just be careful when you go into
Rasputin really is not a restaurant, it's a way of life.
But they have night shows.
Good shows, yeah. So what can we do for you?
I want to ask about non-invasive surgery for vaginal prolapse.
For what?
Just say it one more time. Get a little closer to the phone.
Non-invasive surgery for vaginal prolapse.
For vaginal prolapse, non-invasive surgery.
Okay.
But
Marie, we're going to let you listen to the answer.
Well, there are different types. You know, I don't do this particular surgery, but I do rectal prolapse, which is a similar concept. There are different ways to do these surgeries. You can do them from the outside without making an incision through the abdomen. From below, you can do them through the abdomen, making an open incision. You can do it laparoscopically. So there are definitely different ways to do this. And you might not even need a surgery per se. There are certain procedures that are done for this, which are a lot less invasive than a real surgery. So, you know, if I were you, Maria, I would do some research, which it sounds like you've done. Talk to your doctor, see how he or she feels about it, and between the two of you should come up with a solution.
We're going to thank you very much for the call. We're going to be going now to our rapid fire segment in just a little while. This is the last of our slow fire segment, and this is going to be Enid. Hi, Enid.
Yes.
Enid, where are you calling us from?
I'm calling from Bed-Stuy.
Bed-Stuy. Did you find a place out there to eat?
I actually go to Manhattan when I want a restaurant.
Where do you like to go?
I go to the Gramercy.
The Gramercy.
Gramercy Tavern.
Oh, this is a good restaurant.
Yes.
You go to Union Square Cafe?
Occasionally.
Very nice, the Danny Meyer place. Excellent,
yes.
Excellent.
Yes.
What can we do for you?
I had herpes zoster last year, March, and I was treated, and it seemed I had developed post-herpetic neuralgia.
Okay.
I still have the rash went, but I still have pain. Actually, at nights I get some rash. and the pain is constant.
How old are you?
77.
77. Have you had the vaccine?
Oh yes, I've had everything.
Okay.
And now what has happened under this? It was an extensive new herpes zoster. It radiated from my back underneath my axilla and covered my right breast.
Yeah.
And the flap of the skin before my axilla, that part is so tender I can hardly take a shower now.
What's the question?
Is there any help I can get? Actually, I got Lyrica and Voltaren, which I still take, but they are no longer. They don't help.
Okay, let's go to the panel. Anybody want to weigh in on shingles?
One thing I would say is that there are a lot of therapies that may be helpful in addition to medication. I think if your pain stays very severe, one thing you can do is consider a pain management evaluation. They may be able to make local injections or help you somewhat. So if you're still suffering from pain, I would consider a pain management evaluation.
Interesting. I think it's good advice, and there are some medications that even can fight the shingle, make it a little bit less if you catch it. And of course the vaccine for those 55 and older, new vaccine out there which can really cut down, can be very painful, debilitating. So you okay, Enid?
The pain management.
Yeah, that's a good answer. And call us back. Let us know how things go.
Okay, thanks.
We're now in the rapid fire segment officially. We're going to go around the room to answers here. Andrew.
Yes.
You're in the rapid fire segment, but I understand you have the quiz answer?
Well, I have two answers.
Okay, step back now, and let's hear the first answer, nice, loud, and clear.
Bat.
Is it a bat? Oh, you know, and I thought you had it there. I like that one. I think actually Dr. Shagnovitz went with bat, right?
All right.
So anyway,
I have one more answer if I'm allowed to.
No. Well, what can we do for you?
The last couple of months I've been having cramps in my legs and arms.
Okay, we're gonna. And what's the question?
What could that be from?
Dr. Saylor, you're leading off.
I would check your electrolytes, Andrew. Maybe your potassium is low, your magnesium is low. Those would be some common causes of cramps.
I 100% agree. I think you should see your doctor, maybe get some blood drawn, and it's a possibility it's an electrolyte imbalance.
Dr. Shagnovitz.
Yes, I think a lot of answers will run to the same theme. Please see your doctor, be patient, and be clear about your symptoms.
Does that help you?
Yes. Well, I'm taking a medication. I don't know if it's related to that. Metoprolol?
Generally does not cause cramps. But again, you need a full set of blood tests. You need to have a careful physical exam. And then your doctor will be able to make recommendations and further referrals as needed.
Thank you and good luck with that. Now we're going to go to Eileen, who's in the second in our rapid fire segment. Eileen?
Okay.
Now what's the question?
Well, my question was, I'm 88 and they just found out that I have emphysema.
Emphysema? We're going to go around quickly.
And I gave up cigarettes in the early 70s.
Okay.
But the doctor said, you know, if you did smoke at all.
We're going around the room here. I'll start off this time with Dr. Stevens.
I agree. I think definitely talk to your primary care doctor. Possibly you may need a chest x-ray if you haven't had one.
I'm getting a CAT scan.
All right, well, I think that's a good start to see what's going on and make sure there's nothing else going on that you don't know of. So I agree with that.
All right, thank you very much.
Wait, don't go anywhere.
Oh?
These words can be very, very frightening. And certainly we should try to reassure you that it is a continuum. You can have mild emphysema or severe emphysema. And so go beyond the word. Ask your doctor to do appropriate tests, and it may turn out not to be a very pressing problem after all.
Batting fourth, Dr. Saylor.
I agree with everything that my colleague said. I would just add that close follow-up for emphysema is mandated. You did the best thing by stopping smoking. So exercise, try to walk around as much as you can. I think that will help you.
Yeah, well, I mean, I haven't smoked for 48 years.
Thank God for
Beautiful,
that.
beautiful. Thanks a lot. We hope you feel better. Now, this is like bingo when you rip up the card. I hope you didn't rip your cards out there because we still have the quiz wide open. We're going to Mary on line 4. Hi, Mary.
How are you?
Good. How are you doing?
Okay, I'd like to ask a question, please, very quickly,
Sure.
about I was diagnosed with non-calcified lung nodules, one in each lobe, okay, and I have cylindrical bronchiectasis. My question is, my blood work has changed. My white blood cells are elevated, my platelets go down, and my red blood cells are not functioning properly. My question is it possible that my blood is being, affected by these nodules?
That is remotely possible. There are certain chronic infections, such as a TB-like infection called Mycobacterium avium complex, that could affect your blood. There are also there's lots of causes of lung nodules, but some other ones that could be affected in your blood. May I ask, are you a smoker?
Excuse me?
Are you a smoker?
I was.
You are, okay.
But I stopped 34 years ago.
Well, that's good news. So,
yeah, but I know it does come back to you later on.
Right. So I think follow-up CAT scans would be helpful. Of course, if you get fever, if you cough up blood, if you have more shortness of breath, then that would require maybe more urgent attention. But it sounds like you're following it the appropriate way.
Yeah, I'm very up on the game. And the other issue is I had extensive blood work done, and it's showing that something is going on with my blood. Okay, and the doctor said to me, a complicated case. I have two separate issues, a lung and a blood, and he mentioned a leukemia or myeloma in the future. And if that is the case, and these nodules are a lung cancer, it's impossible to survive with those two cancers.
Yes, it is.
It is impossible, correct?
It is possible.
It's
very
possible to survive?
It is very possible.
Really? That I'm going to come to see you?
Very good. And any comments on the blood dyscrasia?
I agree. It sounds like it may be something completely unrelated to the lung nodules.
Right,
so,
that's what he said to me, too.
Yeah,
and what's happening now, I'm starting to feel bone pain.
As Dr. Sala said, I would follow those, and I think you're doing the appropriate thing.
Dr. Shagnovich, you're okay?
I agree, yes.
Okay, excellent. Let's go now, Ariel, who may have the quiz. Ariel.
Yes, sir.
How are you doing? Where are you calling us from?
I'm calling from Hollis, Queens.
From Hollis, Queens. Very
Yes,
nice
doctor.
out there. And there's a rumor that you may have the answer to the quiz.
Yes, doctor.
Okay, what's the most populous, whatever, it's very tough to ask, the species of mammals?
It's man. Or
What'd you say, mice?
Man.
Man.
Man. You said man. Okay, is it man? Oh, you were so close. You had the beginning, the letter is correct. The first letter was correct, but not the last two. Do you have any questions for us, Ariel?
No.
He's shocked. He's shocked. He thought he had man. Good guess, though, Mario, but no cigar here. Okay? Thank you. We go to Mercelin. Hi, Mercelin.
Hi.
I like that name. What does that mean?
It means love.
Whoa. I have to use that to my wife tonight. Mercelin.
Well,
okay.
That's good.
How are we doing?
Okay, I have a couple questions.
Well, what's the first one?
Okay, I have a defibrillator put in about a year ago, and I have hypertension, and my blood pressure seems not to be able to be going down. I am on enalapril, metoprolol, and the cardiologist put me on Bidal, which one of the medication wasn't working properly. So he broke it down, and I'm on hydrolyzine.
Okay, we got to move fast because we'll run out of time. Dr. Shack, what's the question?
Well, I want to know because on the scar by the by where the pacemaker was put in, it's grown very large, and sometimes I feel a pain sticking me right where the surgery took place.
I'm going to ask Dr. Shagnovich to take that because we have very little time.
Okay, so defibrillators now are more common, wonderful devices when used appropriately, as I'm sure it was in your case. You should see the person who implanted it if you have any discomfort at the site of the pacemaker or a defibrillator. And please work with your doctor. Blood pressure is controllable. It's just a matter of persistence and adjusting medication.
Thanks, Marcelin.
Okay.
Be well. Let's go now to Marie. Hi, Marie.
Hey, how are you?
How are you? Where are you calling us from?
I'm actually calling from Brooklyn.
Which part?
Brownsville.
Okay, Brownsville. Do you have an answer to the quiz?
I have no answer to the quiz.
Okay, what's your question?
My question is, back in 2002, I had a surgery. I had my tubes tied. And in 2005, I had 2 pregnancies, one ectopic pregnancy and one miscarriage. So my question is it possible for me to have a normal pregnancy, or do you recommend at IVF or IUI?
You know what I would suggest? I want you to call next week when we're going to have more, someone who will be in a better position to answer that question, okay?
Next week?
Yeah, call us next week.
Thanks.
Now, Maria is on line 1. Hi, Maria.
Hi.
I understand you might have the answer to the quiz?
Yes, mice.
Yes?
Yes.
What's
mice.
the answer? What are you saying?
Mice.
Mice.
She says mice. She says mice. Could it be mice? Maria, it's pandemonium in the studio. Hello?
Yes.
You got it.
I did?
Yeah, you won. What do you think about that?
Great.
Yeah. It's kind of a letdown. I was kind of expecting a little more. But you're going to get this plaque, beautiful handmade plaque.
Okay.
Do you have one of those?
No.
Do you have a place where you're going to put it?
Yeah.
Where's it going?
On the wall?
Beautiful, beautiful. Congratulations. You're one of the few winners we've had. And we've had 20 of these plaques that have gone out.
Okay.
So call us back next week, okay? Let us know how you like it. We're speeding it to your freight, okay?
All right. I will.
Take care.
Thank you.
Be well. I can't take the last call, I'm told? No. Okay, I'm sorry. I had one. We're going to get back to you next week. But that's it for this episode. I don't know, the time flew by. I want to thank Dr. Anthony Saylor, Dr. Daniel Stevens, and Dr. Alexander Shaknovich for coming in. We hope we've been able to help you. Now, it's good to remember you should always be proactive about your own health. Speak to your doctors about your concerns. Go for second or even third opinions, just like we've talked about tonight. In the meantime, visit our website at netny.net/askthedoctor. Here you can see video blogs, the tablet column, podcast, the forum, and many more. And I want to thank Dr. Linda Lapatosa, our quizmaster, for that tough mice. Really, right under the bun, someone have got it. Next week, we're going to continue our discussion of cardiology, and we're going to talk about geriatric medicine and rheumatology. So for our first of our season finales, next one will be our second. I want to say goodbye, and I'll see you in the tablet. Thank you.